Hi. So, this is the last one in the series of five. We've talked about how to record a history, what happens after history recording in terms of anatomy, in terms of physiology, in terms of biochemistry. Then we've also discussed how to write a prescription. This one thing that I'm addressing now is economic, social, and environmental viability of a prescription. This is something which goes beyond any system of medicine. This is common to all the systems of medicine. Something that is normally not discussed as part of any training program or any uh, teaching, not even usually in textbooks. But this needs an understanding, and this follows two different ideas. At the same time, one of the ideas supersedes the second. I'll first pick the second idea, that is of situation based medication and its costing. Say you have a patient with burns, or you have a patient with cancer, or any other condition which requires a lot of special needs. It has a lot of special provisions to be made so that the patient can get cured, or if not curable, then survive with least of pain. These provisions are sometimes such that can be borne by the patient in terms of environment. Sometimes they are necessary, and sometimes within these two clouds a third element comes in, that is created. It is always this created environment that is dangerous, because that is what ultimately adds on to cost. Cost in terms of mental health, because it puts up a pressure on the mind of people who are involved, the patient and his attendants. Cost in terms of money, because that is an extra cost which probably could have been done away with without having to use it. Cost in terms of social impact, because the people who surround you, or surround the family, surround the attendants, they tend to pick it up in the form that, okay, how to go about this, how to bear with this, will this be possible, how will they manage it, and that sense of pity just keeps drawing on. This adds to a certain degree of pain. This pain just keeps nagging and keeps nagging even for long after the condition is done away with. The other that supersedes this special provisioning is a general form of prescription, or the basic attitude of the prescription, which applies to all the conditions. That is to say that when you prescribe, try and come back to the old model where your prescription has majorly things that are only required and do not find a substitute. In case of Ayurvedics also it applies the same. Say for example you need a strong diuretic, you can combine a couple of drugs maybe, but just for the heck of it, you don't have to make it something which has, say, metallic. If you can do something without a non-metallic drug version of the drug, it is always better. It's not only the terms of cost that it makes a difference. Cost-wise, it makes a huge difference. But it also matters because you're not exposing the body to the environment where it is being made dependent on a catalysis of elements which perhaps the body already has. So an overloading of micronutrients can also be dangerous. This basic condition if you guard in terms of prescription of not using unnecessary medication, automatically takes care of other things in terms of diet, exercise, routine. Then you don't pick up in terms of diet certain things that you know are not locally available easily, and you don't push a patient to consume things which probably will become too pricey. Say for example, you have n number of other options, better options than a pomegranate to raise a hemoglobin, banana, jaggery, small things, green leafy vegetables. And promoting a pomegranate is relatively a much costlier proposition. Why not do that? Give the patient an insight of variety of options available. That helps him understand also that his problem is not irrevocable. His problem is not something that he cannot win over. Because otherwise, the limitation of our resources makes him think his problem is too big. Economic and social aspects. Now, this was economic and looking at it as social. When you advise certain things like eat vegetables or things like that, you allow the whole family to become a part of it. You don't ostracize the family, because even if they go out, say, shopping for their daily needs, they're not looking for something very special. So when somebody talks to them and wants to know how he's faring, they can simply say that he's doing well. And because purchases are out of the blue, their purchases are not such that people would think, okay, he's consuming this kind of a thing, presenting us some special picture, something that they feel is not easily affordable, cost-wise. Even the society takes it, okay, that means he's doing well, and then it comes back to you as your goodwill and your reputation that you could have the thing in a little cost, economically, socially, personally, and that little cost got spread out such that the average cost of treatment in terms of money itself fell well below a common version of things. This element of human sensitivity is what is integral to a physician's practice, and this is what exactly I can say or summarize as is the concept of taking health beyond healing. Health beyond healing, the entire concept where we are talking about these lectures and we look at building on things, is basically all about taking healthcare to a point where it does not talk of healing. It talks of a whole health, a holistic health, and it takes care of these small things which are otherwise probably ignored in general practice. Given this, all these 5 lectures done, I hope people who have followed these lectures or who will follow in future will get an insight into how telemedicine should work, how much of an effort, time, devotion it takes when it comes to making it for a situation where you are handling or being handled by a physician sitting at a distance using telemedicine. And I also hope that people will come together, people in need will come to us, people who look forward to something which comes close to them as people will come to us, and we shall be able to together hold each other's hands and move across a path and take it and make it true that health is actually health beyond healing. Thank you.